Welcome to the AUA News Inside Tract podcast. Today's Inside Tract podcast is part of the Global Perspective series, which is brought to you by the AUA International Programs Department. We'll hear from scholars of the past and present as they talk about what they've learned, how they plan on applying those lessons, and the impact of international collaboration on their professional growth, research, and patient care.
Welcome to the AUA News Inside Tract. I'm Niels Johnsen.
And I'm George Koch. We're excited to be part of this new series, Global Perspectives, where we explore the AUA's Academic Exchange Program and its impact on urologists around the world.
So this week we're sharing our experiences with the AUA Exchange Scholars program in India, where we both spent a couple weeks this past January. We're going to talk about what we learned, what surprised us, and how this international collaboration is shaping the way that we now practice urology.
And we'd be remiss if we didn't mention that this program, the AUA Exchange, is brought to you by Teleflex. They're a global leader in medical technology, and they've been a proud sponsor of the AUA Academic Exchange. Couldn't be more grateful to them for having given us this opportunity.
Yeah, very, very thankful to Teleflex for letting both of us do this program. So George, tell us a little bit about what initially drew you to apply for the AUA Academic Exchange.
It was a bunch of things, actually. I have always been interested in international health. I was about 6 months into practice when I applied for the exchange, and I saw the opportunity to potentially see a different way of doing things and kind of seeing how they reconstruct urethral strictures, which is what I do in practice around the world. For those of you that don't know, I trained under Dr. Johnsen originally, and then ended up going to the same fellowship that he did. So for me, the past 5 or 6 years, I'd really been taught to approach urethral strictures a certain way. And I thought it was really exciting to potentially get to see another way to do it and kind of compare and contrast the way that I learned to do things from you, honestly.
Yeah, absolutely. I'm a little farther into practice than George is, but I thought the academic exchange was a great timing program for me to do. I think I was about 6-7 years into practice at that point, because I'd kind of established my own routine, my own way of approaching things, but kind of stuck in that process. And it's good to get new perspectives and new ideas brought in. And I can't say enough about Sanjay Kulkarni and the folks in Pune, where we were in India, about kind of opening our eyes and giving us these opportunities to learn new ways to do things.
Yeah, absolutely. What were your expectations before going to India, and how do they compare to the experience?
I really didn't know what to expect going to India, either just as a visitor to the country or India as an observer in the operating room. The thing that I was struck by the minute we got there was just the kind of tremendous hospitality of everyone there. Visiting as an AUA scholar is really, it's an opportunity to kind of be treated like almost like a dignitary when you're visiting. People really want you to get the best experience possible. We were taken to people's homes for meals, and just a great opportunity to kind of be welcomed into their community and their families. And then, from a cultural standpoint, it was fascinatingly new. I mean, there are literally billions of people. But it was just a fantastic opportunity to do something that otherwise I may not have had a chance to do.
Yeah.
What about you?
I mean, I think they really stressed the full culture experience. We were eating what everyone else was eating. We ended up getting a meal first thing off the plane with Dr. Kulkarni in his home, which was just amazing, an honor. I think that they really tried to integrate us into the system and the process, which was just you didn't feel like an observer, other than the fact that we weren't doing the surgery. You really felt like they wanted you to be part of the team and part of the thought process. And
yeah, and there's a lot of back and forth exchange about this is how we're doing it. How do you guys do it there? What are your thoughts? Have you considered this sort of approach or this sort of management strategy? And it was a really great opportunity to kind of exchange ideas, exchange experiences. I think we were probably the larger benefactors of that because Dr. Kulkarni and Dr. Joshi in India, where we were, have just this wealth of experience and knowledge. But it kind of brings me to my next question for you is, what was the most striking difference you saw in their clinical practice versus ours?
For me, having recently been a trainee and now being in an academic setting, you're in an academic setting. I think that that the way that their training program works is very different from ours. The master surgeons are doing a lot of the surgery at the beginning of their training experience, and then there's a graduated autonomy, but I think it's a little bit slower than and more deliberate maybe than our US experience. As I found so much value in watching some of these guys operate, but I also, while watching it, was like, I don't know that I would have been prepared to do this fellowship because there's so much graduated, deliberate, mentored autonomy as opposed to the US system where, as a fellow, you come in and it's really more of a finishing school. So I think the timelines are just different. But that was a big difference for me that I was a little struck by. I don't know about you.
Yeah, one of the other things I was going to add is one of the nights that we were there, we did sort of a journal club town hall type meeting with a bunch of the urologists in Pune where we were. And so we had all these different urologists and surgeons from around the area. And we all kind of met and talked about our healthcare systems and their healthcare systems, our training process, their training process. And it was really interesting to kind of hear the differences and dynamics. And, there are things that they're doing in their system that I think would benefit us. They got some ideas from ways that US healthcare and academic medicine are run in the US that could maybe benefit them. So again, I think it was, just really, really eye-opening exchange of ideas and practices that I thought were really valuable.
Yeah. How would you feel, we are dancing around a little bit, but how would you feel the exchange has affected the way you think about urologic research or urologic education, or both?
It's interesting. The research part was different with how they approach it there. As a joke, one of the guys, when we were at the big annual meeting, said, "Hey, before you give your talk, we want to see pictures and videos. We don't want data and numbers. Like, that's not what people are that interested in." And he was saying it in jest, but there's a lot of educating with real life experience. And we had a great bunch of kind of non-clinical, non-medical experiences while we were there. We were lucky that some other kind of delegates from the AUA were at the national meeting when we were there. We got to spend a lot of time with them and go do some kind of sightseeing and cultural things. And the two things that really stood out to me, or maybe three things, were when we saw Dr. Kulkarni, who we were going to spend time with after the annual meeting. We were flying from Chennai, where we were, to Pune, and we told him what flight we were on. So he changed his flight to fly with us there to just make it easier and more convenient on us. And then once we got there, we went directly to his house and had lunch with his family, which I thought was just incredibly hospitable and kind. And then a week or two later, Dr. Kulkarni's wife was insistent that we go to a shopping mall to get presents for our wives to pay back for spending 2 to 3 weeks out of town on this trip. And it was wise and sage advice from Mrs. Dr. Kulkarni. Yeah.
We at Ohio State, we were a receiving institution for an academic exchange member from Brazil, maybe 4 or 5 months after our trip to India. And I remember looking back on our trip to India and thinking, I've got to be, on top of my game to make sure that this fellow has a great experience, sees what he wants to see. I got to make sure he gets the cultural feel for Columbus, all because I felt so indebted to the Kulkarnis for their.
We actually, I can't believe I haven't mentioned this before, but at Vanderbilt, we have hosted a number of exchange fellows as well. And we hosted a guy from India who I saw at the India national meeting, and we got together and talked. And so again, it's these sort of programs and opportunities are just, they're incredibly valuable for kind of networking and education and sharing of ideas and just really getting to know the community, a kind of global community of urologists.
Mhm. Have you brought back any principles or ideas or even surgical techniques to your practice?
Oh my
after the-
goodness. Yeah. I mean, I have a whole notebook of technical things, thought things about approaches, workup, that I noted down over the 2 weeks that we were there. It was just, you think after you've been doing something for 5 to 10 years, you have a pretty good grasp. And I think one of the benefits of doing a program like this is it just opens your eyes that there are different ways to do things, and it really just it's a great time to relearn things that you thought you knew. And so I think that's great. What about you?
I have a similar notebook. It's got technical stuff. It's got quotes. I felt like Dr. Joshi and Kulkarni both had some great taglines.
Fantastic.
Great,
Yeah.
for some of the things that we do. So I noted all those down. And again, I was fresh into practice, only 6 months in. I had I think a pretty consistent viewpoint and structure on how things, because I trained with you, because I trained at the University of Washington, and that was kind of a continuum. So it was interesting for me, maybe not to take a bunch of new things and add them, but just to like see what the different perspectives were. And this may not be something that every exchange gets, but because I was with you, I could talk to you about kind of what things you were planning on integrating.
And it's important to note that George and I had no idea that either one of us had applied for this. And it was just by chance that we were both selected for it. But it was a great opportunity to go together because we hadn't been working together in a couple of years. And so, and we both kind of come from a training perspective from a similar school or same school of thought. And so I think it was eye-opening for both of us to be there at the same time.
Yeah, I'm going to be excited to listen to kind of the rest of the series, because it will be interesting to see what the other kind of pairs or groups of fellows, like how they interchanged experiences, because we had some common experience before. It'll be interesting to see kind of the other side of it.
The other thing is that at Kulkarni's hospital, Eurocol, there were other visiting residents, primarily from all over the world. There was Europeans, South Americans, some people from other areas of India. And so there was just this even more of an opportunity to kind of exchange ideas and talk about the way that things are being done. And it's just an incredible opportunity. How do you feel like this whole experience has changed your maybe perspective on kind of global urologic education or research? Or
Yeah, I mean, I think that I've actually done a research project with Dr. Joshi since then. The kind of a collaboration between our society, the genitourinary reconstructive surgeons, and his society, the International Society of Reconstructive Urology, and it's been a really interesting way to kind of really take a pulse of like what different ways we do things across the world, why we do them like that, whether they're training based, whether they're experience based, whether they're resource based. One thing I found really interesting from their perspective when we talk about research is just because they do 200 to 300 urethroplasties over the course of a year for people all over India, like they have to tailor their follow-up plans a little bit, and kind of thinking about how resources and settings change what we would consider like our pathway or our best practice, I think was really interesting. So that's definitely something that I've kind of taken away from the experience.
Yeah, the other thing from the model that they have set up in Pune is that, like I said earlier, they have people coming in from around the world, and often these are people coming from what we would consider like low to middle income countries or kind of underserved populations. And they have this model set up where they're training fellows in Pune, where they're doing hundreds of urethroplasties a year to be able to go back to their home countries. There was a fellow from Nigeria who was there, and kind of take a lot of these resources and the education that they gain there back to their home countries. And it's something where, that model, there are some places in the US that do that train more international fellows so that they can go serve underserved populations around the world. And I think that was something that was really, really interesting and admirable that was going on in Pune.
Mm-hmm. What's next for you for international exchange?
Yeah. So I've been lucky to travel to Africa, to Malawi now to go do urethroplasties. I'm going back next month, I think. There's potential for a trip to Liberia. And I kind of view these trips a little differently, kind of in context of what I was just saying, where these are opportunities for us to go kind of work with the local urologists there and try to use some of the educational techniques that we learned in India to help teach them how to approach these cases and do it in kind of a more resource limited environment, to provide care to some of these patients. And I think it's just the opportunities to kind of pay it forward from what we learned in India. I think it's great.
Yeah.
You?
I am going to Ukraine in a few weeks on a surgical mission trip with some folks from Cleveland Clinic and Case Western to do reconstructive procedures. And I mean, I'm going into it, I think I looked at service trips in a much more like go in, provide community service and leave and hopefully, help the people that you operate on. And I think that I'm certainly now looking at this trip more as an ideas exchange, a technical exchange. I'm, hoping to kind of learn just as much from the surgeons that I work with, hopefully as they learn from me, and definitely obviously continue to serve the patients, but certainly more of an exchange than just a drop in, drop out, trip.
I think I would just say my parting thoughts are anyone who could consider or has the opportunity to apply for one of these AUA Academic Exchange programs. We couldn't recommend it more strongly. It's a great opportunity for career growth, for personal growth, for cultural awakenings. Take the opportunity to do it if you're able to apply. And I think it's just a great experience if you can do it.
Absolutely. And I'd certainly thank the AUA, Teleflex again for making this opportunity possible. If you look through the AUA website, it's not just India that you can go to. There's so many different experiences, and getting to see the back end of it, when we were at the meeting and kind of seeing our leaders from the AUA interacting with the leaders from the Urological Society of India, you see like there's a lot of hard work that goes into that, and they made the trip so seamless for us,
Fantastic.
So I mean the opportunity is phenomenal, and I hope everyone takes advantage of it, because it was practice changing, it was life changing.
Well, thank you to AUA News, and thank you for joining us on the Global Perspectives podcast. Have a good day.
This has been Global Perspectives, an AUA News Inside Tract podcast, brought to you by the AUA International Programs Department. For more information about AUA's International Exchange Program, visit auanet.org/exchange.